Everyone. My name is Peter Kelly. I'm the Strategic Partnership Lead with the Department of Education, and I am hosting our third Allied Health session of the week on behalf of the Center of Excellence for Health. I would like to do an introduction here quickly. So we have Kira Gray on the call. Kira is a social worker consultant for the New Brunswick Association for Social Workers. She'll be speaking about the role of social workers, how they distinguish themselves from other mental health professionals, and how they can help individuals in diverse settings. So thank you for joining us today, Kira, and the floor is yours.
Great, thank you so much. Let me just share my screen here quickly. All right, hopefully you can all see that okay. Yeah, thank you, Peter, for the introduction. As mentioned, my name is Kira, and I'm the social work consultant with the New Brunswick Association of Social Workers. I'm born and raised in Fredericton. I've lived here my whole life, and I went to Fredericton High School before continuing on to university, where I attended St. Thomas University and got my Bachelor of Arts in psychology and sociology. And then I continued with St. Thomas University and did my Bachelor of Social Work. And then after graduating that, I was fortunate enough to get the job here with the Social Work Association. So I've been here for about 6 years now, and now I'm doing my Master's of Social Work online part-time through Wilfrid Laurier. So that's just a bit about myself before we get into things. I'm really happy to be able to meet with you all today to talk about the social work profession, including what it is, who can do it, and the different types of jobs that social workers can do. Before getting into it, I'll talk a little bit more about the New Brunswick Association of Social Workers and what it is that we do. So we're the provincial association that oversees social workers and now also social work technicians in New Brunswick. In every province and territory, social workers must register with the college or association in their jurisdiction to be able to. I think we got a new class join on. Hello, everyone. So yeah, in terms of the association, every province has their own regulatory body that folks need to be registered with in order to be able to practice the profession. This is the case for most health professionals, such as nurses, doctors, and paramedics, just to name a few. And in New Brunswick, here, the New Brunswick Association of Social Workers has two mandates. So the first mandate is to protect the public. And this is done by ensuring that all people who practice as social workers and also now as social work technicians and use those titles, making sure that they are registered with the association. Our other mandate is to promote the profession by acting as the voice for the social work profession and now also the social work technician paraprofession here in New Brunswick. Some professions have one association to regulate them and another one to advocate for their profession, but here we do both. We have both of those mandates. We promote the profession in various different ways, including events like these, because although social workers and social work technicians do really important work, people don't always know what that work entails. At the NBSW, we also advocate for social justice and take a stand on important issues in New Brunswick. And we also write guidelines and standards of practice for social workers and social work technicians so that they have different documents to guide them in their work and their roles. So now that you guys know a little bit more about the association that I work with, we're going to watch a quick video before diving into more about what social work really is. And my lovely colleague Lal is going to help me with sharing those videos. So I'll stop screen sharing now.
Hi, everybody. My name is Lal Pachetto. I'm the Communications Officer with the New Brunswick Association of Social Workers. Go ahead and share my screen so you can all watch the video.
And Action.
When I called for help, my heart was beating so fast. I just wanted someone to help me, to help my mom.
My family was in real danger. If they hadn't come, someone in my family could have died.
I was in a lot of pain before they arrived. Without their help, I might not have made it.
Hi, I'm Annie. I'm a child protection social worker. All of these stories are about people I helped. Wow.
So for a little context on that video, that was a social experiment that was conducted last year with real New Brunswickers as part of our public campaign. So quotes were pulled from real stories, and those quotes were read to 10 people. And when they were asked to associate the quote with a frontline worker, none of them guessed the social worker. So we identified the need to modify New Brunswickers' perceptions of social workers so that their work could be better understood and appreciated. So this was child protection specific, but this really goes for all social workers. And with these kinds of social work videos, we're able to show people that social workers do essential work that impacts lives every day. Well, I'll pass it back over to Karen.
Thank you, Lau. And yeah, I agree with that. I saw some of the comments saying it's a touching video, and I agree with that. It really was amazing to see like the real reaction of New Brunswickers when they realized that those stories were related to a child protection social worker, and real stories of that took place here in New Brunswick. So whether you know nothing about social worker, you've seen social workers in movies, or you know a social worker yourself, we know that there are different myths and stigmas about the profession. And we want to share what social work is with you all today, as well as tell you more about social work technicians, because that is a paraprofession that is new to New Brunswick. We try to demystify what social work is through campaign videos like the one we just saw. And I hope this gives you a bit of a feel of how much of a difference a social worker can make in someone's life, just like other frontline workers can. But what is the role of social workers specifically? Social workers and social work technicians respond to social issues like racism, poverty, and unemployment. They also advocate for social justice, human rights, and fair access to health and social services. Social workers are professionals who work with individuals, groups, and communities to improve their psychosocial well-being. And psychosocial well-being includes, mental, emotional, and also social health. Social workers interpret information, and they're responsible for making complex decisions. Social work technicians support social workers in their roles, and they provide more of those hands-on interventions that are really focused on improving social well-being, which would include how people behave and interact with others. I was talking with Lal, and we came up with a bit of a example of how this could be better understood in relation to another profession. I'm sure you've all probably entered a pharmacy at some point and have seen pharmacists and pharmacy technicians. Both of these roles are very important for the proper functioning of the pharmacy, but as we know, they're different. Pharmacists have in-depth knowledge in their field, while pharmacy technicians do essential work to assist pharmacists. This is very similar to social workers and social work technicians, but in a social context. To take the example a little bit further, the pharmacy technician will review patient information, gather the medication, and prepare the product for a pharmacist's review and distribute the medication once approved by the pharmacist. The pharmacist, on the other hand, is the drug expert and can recommend the best medication schedule for patients, can prescribe certain medications, knows and can inform patients of potential outcomes and risks, and can even combine medications to make custom meds for their patients to meet their specific needs. Similar to this, social workers put together a case plan for the client, and the social work technician is responsible for implementing parts of this plan with the client to support the social worker in meeting the client's needs. While the social worker does the assessments and therapeutic interventions with the client, a social work technician can perform other activities, such as accompanying clients to appointments, assisting them with transportation, and teaching life skills. And for your information, there are roughly 2,300 social workers and social work technicians who are registered and working here in New Brunswick. So when we think of social workers and social work technicians, what kind of traits should they have? NB Health Jobs identifies that some key characteristics of social workers are maturity and emotional stability, patience, sensitivity to and an understanding of beliefs and values that are not your own. They need to be good at critical thinking and have good judgment. They need to be resourceful, and it's also important to have communication skills. When I think of other social work specific qualities, I think of having a passion for helping others and also having a desire to make the world a better place. Those are both also very important characteristics. And beyond what we've already talked about, social workers also need to be adaptable, and they also need to be good at active listening, problem solving, and empowering people. And these qualities also apply to social work technicians. So you might now be asking, how do people become social workers or social work technicians? The minimum level of education that you need to become a social work technician is a 2-year college diploma from a recognized social work technician program. To become a social worker, the minimum level of education that you need is a 4-year Bachelor of Social Work degree from an accredited university program. There are also new college to university bridging programs in place that allow students studying to complete their 2-year diploma to become a social work technician. Those students would then have the option of doing another 2 years of a recognized Bachelor of Social Work program to become a social worker. One bridging program example is that people can go to NBCC, New Brunswick Community College, for their social service community worker diploma, and then they would have the option to go to University of New Brunswick, St. John for 2 years to receive a Bachelor of Social Work. And this is something that came about as part of the recruitment and retention strategy that we're leading here at the NBSWA. And we have the goal of making the social work profession more accessible to those who are interested in the field and interested in becoming a social worker. So if any of you are interested in pursuing a career in social work, there's great information on the NBSWA website regarding recognized programs here in New Brunswick, and also the 2+2 bridging program pathways that are available. So how are social workers different from other mental health professionals? I'll now take some time to explain the approach that social workers take in practice and how this separates them from other mental health professionals. Social workers work from a person and environment perspective that's really unique to the profession. Social workers are different from other mental health professionals because they understand individuals within the context of their environments. Social workers believe that it's not enough to just understand an individual's presenting problem. We also need to understand the whole context of the situation and all the different external factors that are also impacting the individual. This really gives us a complete understanding of the situation and what clients are going through. Social workers understand that people are influenced by their environments and that they also have an influence on their environment. We look at how family, community, legal, social, spiritual, and also economic influences impact people's well-being. And social workers also work with individuals to address any barriers that may exist. Here's another visual that shows the multiple levels of influence that we all experience in our everyday lives. Social workers will consider all of these interconnected levels of influence during their first assessments with clients and also throughout the treatment process. Social workers will assess what strengths and challenges exist on each of these different levels, and they'll target their interventions accordingly. Some of you might be familiar with the American psychologist Abraham Maslow and his pyramid of needs, which is called Maslow's hierarchy of needs. So the bottom of the pyramid here represents the most basic needs of a person, and it goes up to their higher level needs. It's presented as a pyramid because pyramids need to have a strong foundation. So the lower level needs really need to be met in order to go up to the higher level needs. This pyramid helps social workers understand which interventions to focus on first. For example, imagine you're a social worker and someone comes to you for counseling because they're experiencing low self-esteem. Imagine in your discussions with the individual that you learn that they don't have a place to live. The social worker will first help them to get safe and secure housing, and the social worker can help them navigate social support systems and advocate for them to make this a reality. And once the person is housed, their other treatment goals can be addressed. By not having to worry where they're going to sleep at night, this individual would naturally have a better chance of having a higher self-esteem. So that's just an example of how these pyramids can help us inform the order of interventions. Social workers understand factors on macro, meso, and micro levels, and how each of these levels can impact individual experiences. There are social work jobs that specifically focus on each of these levels. So if you find joy working directly with people, you might consider work on the micro level. This could involve providing counseling and advocating for individuals and their families. If you wish to work with groups and communities, you may work on the meso level. Social workers at this level may work with specific communities in institutions such as schools, hospitals, or prisons. And if you think your skills are better suited for work behind the scenes to create widespread change and a widespread difference, you should consider work on the macro level. This could involve doing research or policy work. And I'll touch on more roles and examples that fall in these various levels later on. So now we're going to explore some of the places that social workers work, and I won't go over every social work role because really there are too many to count and we would be here all day. But this should provide you with an overview of some of the main areas of practice. While I'm going to be focusing on the jobs and roles of social workers, I also want to note that social work technicians may also work alongside social workers in these different workplaces and areas of work. But the social work technician paraprofession is still new to New Brunswick, so it's really something that's going to be increasing in the years to come. So as you can see on this slide, social workers work in a wide array of settings with different populations and in many different fields. One of the unique things about being a social worker is all of the different job opportunities that it opens up for you. There are so many opportunities to change up where you work and what client demographics you work with throughout your career. For example, social workers can help students at schools and universities, patients at hospitals, community health centers, and through extramural programs, employees in their workplace through employee assistance programs, service users at nonprofit organizations, and service users through various victim services agencies. These are really just a few examples of where social workers work and with who they serve. The government of New Brunswick is the biggest employer of social workers in New Brunswick, and almost half of all social workers work for GNB. Within government, the Department of Social Development is the biggest employer, and social development employs about 650 social workers who largely work in the areas of child protection, long-term care, and disability support services. The regional health authorities are the second biggest employer of social workers in New Brunswick, and New Brunswick has two RHAs, Horizon Health Network and Vitalite Health Network. About 540 social workers work for the New Brunswick RHAs. So now that you have a broad overview of the scope of practice, let's look at the different areas of practice and what it can look like to work within them. So we'll start with child welfare. Often when we hear and think about social workers, this is what we're hearing about and what comes to mind. So we'll break it down a little bit of some of the different specific roles that social workers do within the area of child welfare. So when people have concerns about the safety or well-being of a child, they'll call the Department of Social Development. A social worker will get that call and they'll screen it and they'll determine whether or not the call and the situation warrants an investigation. If it does warrant an investigation, then a social worker from Access and Assessment will go and investigate. This means that a social worker will meet with the child and their family to assess the situation, to ensure that the child is safe and determine what the needs are, if any. It varies a lot, and it's really case by case because every situation and call is different. But in certain cases, the social worker will determine that the family needs ongoing support, in which case a social worker from ongoing child protection would become involved. At times, parents aren't able to care for their children, and in these cases, a social worker with children in care may become involved and children may be placed in care. This may be within a group home, in foster care, or in kinship care, when children are placed with other family members or an adult that they are close to. When children are in care for extended periods of time, they may also become involved with social workers working in adoption services. There are also social workers working in family group conferencing, which is kind of a cool program that's come about in the province within the past 10 years. Family group conferences, it's a family-centered decision-making process that brings together a family group, social workers, and also other service providers to help develop a plan for the safety and well-being of children. Family group conferencing may be used at any time after a social worker has determined that a child needs protection. and the social worker and the parents agree that such a meeting would be appropriate to plan for the child's safety and well-being. During a family group conference, the social worker leaves the room and the family has the opportunity to work together to develop a plan for themselves and for the child, and they'll present this plan to a social worker. The social worker needs to sign off on the plan to ensure that it meets the child's needs. But this process gives the family a chance to support the child and to keep the child within their circle, because that's everyone's goal, as long as it's in, the child's best interest. Within child welfare, there's also a program called Youth Engagement Services. This program is for youth ages 16 to 18 who aren't able to live at home, largely due to abuse or neglect, but who still need support. Youth Engagement Services provides youth with financial aid, life skills, and other supports necessary to promote the youth's successful transition to independent adulthood. So there are social workers working within each of these programs within the Department of Social Development in the area of child welfare. Oh, we now have another video. So I'll stop screen sharing so y'all can get that shared.
Yes. And I see that Emily, you had a couple questions regarding social workers within schools and how they can help there. And so Kira does have an example a bit later on regarding school social work. So we'll be able to address that.
My name is Trevor Breen, and I am a child protection social worker with the Department of Social Development. When we think about community and what we want for a community, we want a community that's cohesive, that's coming together. We want a community that's strong. And when we look at those individuals in protection that we're involved with, they're the most vulnerable. So if we truly want a strong community, we need to recognize that we have to invest in our children and youth. They are the leaders of tomorrow. They are the social workers of tomorrow. They are the doctors and the lawyers of tomorrow. So our investment in child protection is really an investment in our future, the investment in our community. And we, as a society, have not been able to truly understand that when people are in crisis, it's okay to ask for help. Oftentimes with social work and in child protection, we're becoming involved with children, youth, and families really during crisis situations. So helping to move through those crisis situations and helping families and children and youth understand that that's a bump, it's a moment in time, and truly that they have their entire lives ahead of them. Child protection is truly about relationships. Child protection is about collaboration. It's about making sure that children are not just safe, but that they're thriving. In order for a child to thrive and succeed, it really does take a community. It takes a community to respond, to make sure that children and youth, again, are not just safe, but that they're well.
So that video was also part of the campaign. It was an addition to the social experiment that you saw earlier, that video. And yeah, so this video was meant to add to the social experiment. And Trevor here, this child protection social worker, demonstrated the working with families aspect with the community to show that social workers embody empathy and they walk alongside families using the necessary tools and skills to create a future where children can thrive. And through social workers dedicated guidance and support families find resilience, healing, and the strength to create a nurturing, safe environment where children can flourish. And the guidance and so hopefully you see in and throughout this presentation is not specific to child protection, but all areas of social work. So here I'll let you go ahead with more examples.
Great, thank you. Okay, so I'm not sure how we're doing on time, but I'll try to talk quickly through the next few slides to leave some time for question and answers at the end if you have any. But I want to touch on hospital and medical social work because social workers, as we mentioned, the second biggest employer of social workers are the regional health authorities. And social workers work in all different departments of the hospital, providing an array of services. So the first to highlight is emergency rooms. Social workers in emergency rooms play an important role in the ER team. They do mental health and suicide assessments. They do safety plans and intake assessments for addiction mental health services. They provide resources and referrals to people there. And they also provide one at a time or single session therapy. Social workers also work in psychiatric units and do various assessments, counseling with patients, also with their families, and they work collaboratively with psychiatrists and physicians and other members of the healthcare team to make sure that the needs of the individual is met. They also do, discharge planning and connect clients with services for when they leave the hospital. Social workers also are in labor and delivery and help new parents. After you have a baby, a social worker will come in and talk about how you're doing after you've delivered and what kind of support system is in place for you when you leave the hospital and go home. They'll determine any other needs that you or your baby may have, and they'll provide resources for you and baby based on what your situation is. Another area in the hospital where you can find social workers is in palliative care, supporting individuals being transferred to the palliative care unit, as well as their families during this transition to end-of-life care. Social workers are also with extramural program, which is like a hospital without walls, and social workers go directly to individuals' houses to provide them with all of these services. And social workers are also in community health centers doing crisis interventions, safety planning, counseling, advocacy, and referrals. Social workers also work in the area of mental health and addiction, where they do counseling, both individually and in groups, and also work in mobile crisis units. In counseling sessions, social workers assess the basic needs of individuals and incorporate the person and environment perspective that we saw earlier, which really takes into account all of the different factors that are impacting individuals and including these in the treatment plan for the individuals and to inform the therapeutic services that they're giving. And for mobile crisis units, those are things that that's a service that's provided after hours, and social workers provide, go out in community and respond to crisis interventions, and are also, first responders in that way through that program. If you are interested in, providing counseling as a social worker in your career, you're not limited to working within the government services, as social workers also work in various nonprofits doing this type of work also, and also can work in private practice. Okay, so to touch on school social workers, there are school-based school social workers, which typically work within one or within a handful of specific schools. And it's really great to have school-based school social workers because they really know the needs of the schools that they are serving, and they are either close by or on site to provide quick response to unexpected events that can arise. These roles are relatively new in New Brunswick schools, and they're expanding. And there are also social workers that work within schools, but who work within the integrated service delivery child and youth teams. So these social workers provide more in-depth counseling and mental health services to students in schools and are part of the ISD teams, which is an approach that brings together various service providers to provide wraparound supports and services for students. I wanted to touch quickly on policy because policy social work is something that not many people think about or know about, but social workers also use their skills to develop the rules for all these various programs and services that exist. My job at the association is an example of policy social work. And good policy also involves the voices of the people that the policies or programs impact. So social workers also work in community organizing, bringing together all those folks and hearing, their experiences and their needs in order to inform the policies that they are developing. Some other services that are provided to adults include adult protection, long-term care, and also disability support programs for folks with long-term disabilities. So do we need more social workers? That's the big question. And you've probably picked up on several reoccurring words by now. Overall, social workers work to identify supports, assess safety and mental well-being of clients, provide counseling and resources, and work collaboratively with other professionals to provide well-rounded care to people. The answer to that question, though, is yes, we need more social workers here in New Brunswick. There are lots of job opportunities that are currently available and they're projected to be available in the coming years because the social work skill set is really seen as valuable in lots of different areas of practice. So there are lots of job opportunities that exist for social workers. So I think now we have time for questions. If you folks have any last minute questions for me.
Sure. We'll open up the floor to questions. If you have any, you can definitely type them in the chat. But I have one to kind of get things started, I guess. Did you always know that you wanted to work in the health field, or was there an experience in particular as you were kind of going through high school or whatever to kind of shape that decision?
That's a good question. For me, I originally wanted to pursue psychology. So that was one of my majors for my Bachelor of Arts. And it wasn't until university when I even became aware of all the different things that social workers did. And I became aware that social workers are often the mental health professionals providing counseling to people in various programs and services like we talked about. So I really resonated with the approach that social work took. It felt like psychology was a little bit too narrow of an approach. They really understand the way the brain functions, but it doesn't always account all the outside things that are impacting people's mental health. So for all those reasons, I decided to pursue social work instead. And yeah, I'm very happy with that. And that's, I think, been a similar experience for a lot of social workers. But it's mostly because we just didn't know about what social workers did and the job
Mhm.
opportunities that were available.
That's great. Good answer for sure. Um, I'll keep asking questions as long as there's none in the chat. Um, how long does it take typically to find employment coming out of school now?
Coming out of your Bachelor of Social Work, that
Yeah.
is? Yeah, so it's pretty quick. I believe within a month or so, people usually find a job. There's really a need for it. And because there's been a lot of new social work positions developed in the province within the past 10 years, for example, the ISD child and youth teams, I believe that opened up like 90 jobs some years ago, and now there's more school-based school social workers. Those are some examples of the increased need for social work. And so it's been easy, I think, for people with that background to find employment.
Great. And you may not know the answer to this off the top of your head, but is there kind of a salary range that typically these positions kind of stay within?
Yeah, I would encourage people to look that up online. I know that the two main employers for social workers both have new collective bargaining agreements signed. So that information should be available online. My guess, you might verify these numbers, but my guess would be like 60 to 80 or 90,000
Mhm.
would be like an average salary range.
Great. That's perfect. Well, I don't see any other questions kind of popping up, but thank you very much for your time today. It was a very informative session, and it was great to have you. And this will be posted on the Center of Excellence for Health website for other classes to watch afterwards. So thank you very much,
Wonderful.
Kira, and thank you, Laura.
Well, thank you for inviting us, and it was great to speak with everyone.
Thank you so much.
Bye.